Major medical advances in just the past few years have made minimally invasive treatment options for head and neck cancer patients a reality. Dr. K VanKoevering is here to explain.
Minimally invasive surgeries are surgeries in which we can use newer technology to approach and remove tumors that are located in deeper areas of the body without using a big incision in the patient to access that area.
What kind of newer technology?
In addition to the expanding field of robotic surgery, I think we're going to continue to see pretty significant advances there as we're able to reach more and more areas across the head and neck. We use 3D printing because having a tangible handheld model can really help us decide what approach and what angles to take to get access to some of these tumors. Our team of head and neck surgeons here at the James at Ohio State is truly a world-class team of head and neck surgeons. There are very, very few programs in the country who are able to offer that caliber of care and that complexity of surgery to our patients.
To learn more, visit cancer.osu.edu/blog.